Hello everybody, and welcome to the Tuesday edition of Video Clips. And as usual, I'll start with a couple of announcements. First of all, tomorrow night, you could spend the whole evening with us actually. At 6 o'clock is our monthly dinner here at Wellness Form Health. We can't feed you, but you can watch the lecture and discussion that follows on video stream. And then at 9 o'clock, I'm doing a free workshop on the gut microbiome and how to use probiotics to heal up or protect your gut. So if you want to do those things or any of the other things I'll mention real quickly here, just email me at pampopper@msn.com or call the office at 614-841-7700. Another thing is how to get started is on the 23rd. That's another thing. If you're a member, you can watch this via video stream. The only thing we can't do is feed you because we do eat a lot of good stuff around here, but you can participate in all the good learning that goes on. And then we have just a couple weeks left for the annual pass and weight loss special that are our summer offerings. Okay, so this week on Video Clips, I'm doing something a little bit different in response to requests from people who watch this YouTube channel and or get my weekly newsletter, which goes out on Monday. By the way, if you're not a subscriber to that and you'd like to be, you can send me an email at pampopper@msn.com. All right, so people are always asking me, what do you say when somebody tells you they have cancer? What do you say when somebody is closed-minded about vaccines? What do you say when somebody does this? Oh, okay, so, and then people will say, I wish I could have you talk to so-and-so or whoever family it is or whatever. And obviously there's only one of me and I can't talk to everybody. So I thought what I would do is have some pieces that I'm going to post these in the Health Brace Library that are designed for, what I would say to the person if they were sitting in front of me. And in fact, summarize some of the things I say to members when they come in the office here and we're talking about these issues. The first one is, what do you say to the person who's just been diagnosed with cancer? And here's what I have to say to that person. If this is you, I hope that this helps you. And if you have family members, I hope that this helps you communicate with your family members. Stunned, frightened, overwhelmed, and depressed are just a few of the emotions that patients experience after they learn that they have cancer. In spite of being in a state of mental and emotional turmoil, important decisions need to be made about treatment. Some cancer patients report that surviving the decision-making process can be almost as challenging as surviving the cancer. So here are some tips that I think can reduce the amount of stress involved in developing a plan. First of all, tip number one, take some time to figure things out. Patients are often pressured by doctors, family, and friends to start treatment right away. In rare cases, there is an immediate need for some type of intervention, a blockage that interferes with function and requires surgery right away, for example. But in almost all cases, patients can take a few weeks and sometimes even a few months to look into all of the available options before making a decision. This can be maybe more important to cancer patients than other patients who have other diseases, and the reason is that if you choose the wrong treatment, not only does it not work, but it can leave the body in a much weaker state, which may make the body less likely to respond to better treatments. Additionally, outcomes are highly dependent on a patient's confidence in the choices he or she makes, so it's really important to take the time and consider options and make the right decision for you. The second thing, find out if you really have cancer. This may sound silly, but every day people are told they have cancer and they really don't have it. The official term for this is disease mongering. It goes on not only in cancer, but other diseases too. And the definition is broadening the definition of disease so that more people would be diagnosed and the market is expanded then for treatment. The practice benefits drug companies and medical institutions. It actually doesn't benefit patients so much. Some examples, ductal carcinoma in situ, or DCIS, is not cancer, yet women are treated as if they have cancer with surgery, radiation, and drugs. Men are equally misled. Prostate-specific antigen, or PSA, is not a marker for cancer, and testing it has resulted in hundreds of thousands of men in the United States alone being treated for prostate cancer who didn't really have it. So make sure you really do have cancer before you start getting some treatment for whatever is going on with you. Third thing, decide to practice informed medical decision-making. This means having a clear understanding of the risks and benefits associated with any test, drug, procedure before consenting to it. Many times treatment benefits are exaggerated and the risks are minimized or sometimes not mentioned at all. Patients often learn that treatments offer few benefits and significant side effects through experience after the treatments fail or when the side effects become painfully apparent. A common statement in my office is, if I'd known then what I know now, and then you can fill in the blank. So make sure you have a thorough understanding of the risks and benefits of any treatment before you start. Assemble a team. A small group of clear-headed advisors to accompany you to appointments and help you with things like asking questions, making calls, and evaluating research can be very helpful. These people do not need to be medical professionals, but they do need to be open-minded and willing to objectively look at and consider options with you, keeping in mind your point of view on everything because you, after all, are the cancer patient. Postpone making decisions until your emotional state improves a little bit. The worst decisions about anything important are made in a highly emotional state. Now, it is normal to experience a pretty wide range of emotions following a cancer diagnosis, including things like panic and fear. Now, these feelings don't entirely go away after a few weeks, but they usually dissipate just enough so that people can think a little more clearly and then make better decisions. Reassure your family and friends and ask for their support. Well-meaning friends and family members often pressure patients to follow their oncologist's advice and to begin treatment right away. They become frightened when patients start talking about taking time to do research and consider options, and sometimes terrified when patients suggest that they might leave one doctor, find another, or pursue alternative treatment. Tell your friends and family how you're going about gathering data. Ask them to be patient for a short time, and one thing that I found is putting an actual deadline on it. So for example, right now it's July 5th when I'm taping this, and if I were a cancer patient, it would be reasonable to say by August 15th I will have looked at everything and I will be ready to make up my mind. Offer to share your research after you gather it. The presentation of organized information that clearly shows benefits and risks can often help people really close to you to feel much more comfortable about the choices you make. Ask for published research for all recommendations made by your doctors. Your doctors should be willing to provide this because this supports the treatment recommendations they make. Looking at this type of information is the only way you can determine whether or not a treatment is right for you. If your doctor refuses to provide research, you might consider changing doctors, finding somebody else, or consulting with somebody who can dig up some evidence and review it with you. Evaluate risks of treatments and benefits of treatments before making a decision. Again, most of the time, benefits are exaggerated, risks are minimized, but another issue is that the benefits of treatment are almost always expressed in relative terms, which can deceptively make treatments seem much more valuable than they actually are. Here's an example. A study reports that the incidence of cancer recurrence in patients receiving a treatment is 2%, and the incidence of recurrence in the placebo group is 4%. The treatment is commonly represented as being a 50% reduction since 2% is half of 4%. This sounds impressive, but the absolute real risk reduction, this is the benefit to you, the patient who's getting the treatment, is only 2%, or the real difference between the two numbers. For many people, a 2% reduction in risk does not sound nearly as impressive, and enthusiasm can be lessened even more when considering potential side effects and risks. Now let's continue our hypothetical example for a second and say that the incidence of serious side effects in the group receiving treatment is 10%. Somebody might reasonably conclude that a 2% reduction in the risk of recurrence is not worth the 10% risk of experiencing side effects. In other words, the risk of side effects is 5 times greater than the risk that, or the benefit that you might achieve. You should have all of this information about all of your options before you make your choices. Next, practice holism, spelled with a W-H, instead of reductionism. Cancer is a complicated disease, and regaining health usually requires a comprehensive strategy. Eating optimally is important, but eating well while receiving a treatment with a low efficacy rate may not achieve the outcome that you're looking for, which is living a long life. Many cancer survivors, particularly those who have rather grim prognoses, attribute their success to using several strategies which together constitute a comprehensive plan for changing their health and changing their lives. And last but not least, stay flexible. It's okay to change your mind if you feel that something is not working for you or you discover new information. You can stop treatment, you can check out of a hospital, you can change doctors or visit a clinic in another location, and you can do all of these things even if people close to you disagree. Remember that you are the person who has the most to gain or lose from the decisions that you make. Taking control of your health and taking control of your life is very important for cancer patients who are intent on surviving and thriving. So the purpose of this is not to actually walk somebody through the decision-making process, but just to get somebody set up to go about it in some kind of an organized way and to address the common issues that patients face, which are rushing too much into treatment, not having family and friends on board, trying to do everything themselves, and not taking the time to really look at the long-term outcomes for the things that are proposed to see if they're really worthwhile. So for those of you who ask, if a cancer patient were sitting in front of me at any time in my office, these are the kinds of things that I talk to that person about. So I hope this is helpful. As usual, pass this on to anybody who you think might enjoy watching it. This will be posted in the Health Brace library and available for download within the next 24 hours. And I'll be back to you on Thursday with more news.